My name is Dr. Trey Remaley. I'm an orthopedic surgeon trained in sports medicine, and I've been at University of South Florida and Florida Orthopaedic Institute since 2014. I did my fellowship here in Tampa as well in 2012 and have been here ever since. The types of conditions we treat through sports medicine range anywhere from ligament and tendon injuries to bony injuries that may have been sustained in athletic competitions, or somebody working out through the weekends or playing pickup sports games that they become injured. We'll treat anything through hips, knees, or shoulder type injuries that need to be addressed to allow the individual to get back to their sporting activities. I tend to approach every patient on an individual basis. Everybody is different. They may come in with similar injuries, but the way that you address those patients or the way that you're going to focus your treatment plan and set expectations really varies on individuals. It changes patient to patient. I truly enjoy being able to work with a patient as a team and going through their treatment plan, their diagnosis, their management, surgery if they need it, as well as their post-injury recovery, being able to get them back to the level of activity that they were prior to the injury, or back to their activities of daily living or their weekend activities that they want to participate in. That's really what makes sports medicine for me rewarding, is getting the patients back to their activities. The idea with Florida Orthopaedic Institute and myself really coincide with the patient being the number one priority and making sure that they have the best options available for their treatment and the best options available to set their expectations for outcomes.